All right, so the deadline for the vaccine mandate has come and gone. It was yesterday for most state workers, and the people who refused to get a vaccine and weren't successful in getting an exemption are now out of work. They protested, they striked, they threatened, and in some cases filed lawsuits. They made dire predictions about shortages of workers. But as the data is quickly showing, vaccine mandates actually work. In Washington, 92% of state workers got vaccinated before yesterday's deadline. As you can see, the numbers are in. Most of the school staff is vaccinated, but some districts did say they had to fire some school bus drivers statewide. That demographic took a bit of a hit. About 90% of the Department of Corrections staff is vaccinated, and 93% of state patrol in Washington got the vaccine. 127 workers with the State Patrol left their jobs rather than getting the shot. We saw some of that yesterday. Again, that's 127, though, out of more than 2,000 employees. Still, they're protesting. Recently fired troopers made a display of their shoes and their hats at the Capitol building in Olympia today. You can see that photo. And they're doing that to show support for, again, those 127 who lost their jobs. In Oregon, a similar situation. The vaccine mandate largely worked. The Oregonian reporting 80% of state workers had been vaccinated as of last Friday, and 10% got exemptions. But thousands of workers who are covered by unions got an extension until the end of November. So that group is still kind of out there. Oregon State Patrol says 2 troopers resigned in protest to the mandate. 2. On top of that, 11 more are on leave. Healthcare systems also say they had a big jump in vaccination rates, most of them getting near 90%. So, as it turns out, when your job is on the line, a lot of people will decide to go ahead and get a vaccine. But what about if you aren't getting paid because you still, do you still have to get vaccinated? Of course you do. And the mayor of Warrenton said he was ready to declare a state of emergency, fearing he would lose most of his volunteer emergency first responders. They fell under that mandate category, even though they were volunteers. As it turns out, most of them ended up getting the vaccine.
Many of them consulted with their doctors again. Some got vaccinated. Actually, most got vaccinated. The vast majority are vaccinated. We actually ended up having people step forward hearing about the crisis looming, and 2 of them, or 3 of them actually had certifications that were immediately transferable. And so they stepped up, and we actually have a total now, as of today, 5 additional members of our fire department.
That's the mayor there. When we first talked to him, you might remember, he was really worried because more than half of the volunteer emergency responders in Warrenton said they did not want the vaccine, were not going to get the vaccine. But along the way, they changed their minds. And the mayor says that happened because they had support, not judgment.
You know, they're volunteers. So this isn't like an employee where you can just say, you're going to do this. And, if you don't, something's going to happen, So there was just a lot of space. We just provided a lot of space, a lot of listening, and just kept at it. But I also, teamed up with the fire chief to make sure that there was political support for them to have that space. And also, my main role was to inform the public of what was about to occur, to not condemn the volunteers because they've been with us doing this, responding to these calls since the beginning. Nothing's really changed other than a rule has been passed, and that support, as well as that open space that the chief gave, combined helped them come to a different conclusion for most of them. And as a result, they move forward.
Again, support, not judgment, he says. So we do know about other small towns and rural areas that are concerned about shortages, and we're checking in on them. We also want to hear from you if you know of any places where there is a problem.